You ever wonder why whatever your doctor tells you for some reason doesn't seem to stick? And it's not like he doesn't know what he or she is talking about, but for some reason, like the words just like come in one ear and out the other. Today, I'm going to tell you why your doctor has so much trouble on selling you the promise of being healthy. I'm yours truly, Dr. Pierre, your favorite board certified internist. Welcome to another episode of Medicine Mondays. And I get to talk a little bit about this aspect of your doctor being, and I hate to say it, a terrible salesperson. And you may be saying, Dr. Barry, like, why are we even talking about sales when we're talking about my healthcare and more importantly, my physician? Like, why is that even a conversation that needs to be had? Well, after about a decade of experience, I've realized that the reason why some doctors are able to get results where others just aren't is that some doctors are much better at selling the aspect of being healthy than you are at the need to buy being healthy. And I think that's one thing that as a patient, again, I'm a doctor, I'm also a patient. As a patient, sometimes it's very difficult to understand that we also need to buy what our doctors are selling. Unfortunately, our doctors don't know how to sell appropriately. This is going to lead on to some, especially because next week I'll be coming back after enjoying a good weekend of one of my favorite conferences, digital marketing, ClickFunnels. Like I said, I'm going to talk about that next week. But like it's all about this aspect of the art of selling. And I said, all right, how do I incorporate this into my day-to-day job, which is being a physician, more importantly, which is being, for a lot of people, especially in the online social media atmosphere, the provider of health information to you. Like, how can I do that? So I think first we have to first start out saying, all right, what is happening that's causing this, what I would say a disconnect in regards to your doctor selling you on this idea of being healthy and you, more importantly, following through? I think first problem, right? Step number one is there's a training gap. And what do I mean by that? There's a gap on the aspect of taking care of patients and training to take care of patients, and then training to be able to persuade patients to make the right decisions for themselves. A few weeks ago, I dropped an episode where I was talking about firing your doctor. And I had one of my colleagues, actually a former attending of mine, say, well, you can't fire someone who you didn't hire, which I thought was a very good point, right? Because we talk about this a lot, especially in this doctor-patient relationship where, hey, if my doctor isn't doing right by me or my patients aren't doing right by me, I need to let them go. So the question becomes, when do we get into that relationship where I've now hired this person, right? Hired being figuratively, but hired this person to be in charge of my healthcare. And when I hire this person to be in my charge of my healthcare, why is it the stuff that I hired them to do, I'm not necessarily following? So I think first and foremost, we have to talk about the aspect of the training gap, which means like the gap of information needed to get your patient from point A to point Z, but also more importantly, the missing information required for your doctor, right, to know what they need to tell you to get you to take some action. I say this all the time, action is everything. Empower yourself for better health. That's all about action. Right? Like, it doesn't matter if the knowledge is there because Google is free. Y'all tell me this all the time. Google is free. So the information is definitely there, but what's actually going to cause you to take action upon the information you might have just learned about, as long as it's important information? So the training gap, I think, is extremely important. I think it's something that will continue, right, to get wider and bigger as the information in regards to the internet, as the information in regards to just healthcare continue to advance, and you continue to see this split amongst where your doctor is and more importantly, where the patient is. So I think the training gap is a big one. I think a big thing, especially with the training gap, is the fact that communication skills aren't really there. Medical school does a great job at, forcing me to go read a book, learn about what I just read, learn about what procedure action I just did, and then do it. But when it comes to the communication, and I'm not talking about the communication between doctor and attending, I'm not talking about that communication, but the communication between doctor and patient. It's typically this authoritarian type style of approach. Hey, you should do this. This is why, and that's it. But we never go through any of the psychological process that's required to get people to take action. Because we just think if I just tell someone, hey, jump, they're going to ask how high. And we already know that that's not the case anymore, especially for a lot of our patients. So the gap in learning our communication skills, which again is not something medical school, I'll be honest, medical school does not focus on that. Would I like them to? Yeah. But that's more for selfish reasons, right? Because I think if you're a good doctor and a good salesman, you'll get more patients, get more money. So I think that like it benefits us, but medical school isn't in that business to be benefiting us. It's in that business of, hey, get some students in here. Let me make them pay this tuition. And you know what? Hopefully they do what they need to do to finish. So a communication gap, a training gap, all of these things are kind of on the umbrella aspect of why it's difficult to get sold on taking care of yourself, especially from a health, related perspective. Number two, the system is not built for quick fixes in regards to getting healthy. Getting healthy, staying healthy is a long process that you got to go through. And you have a system, especially in healthcare, where everything is, hey, you know what? I got 10, 15 minutes to talk to my patient. I got to be able to somehow explain everything about hypertension, diabetes, cholesterol, weight loss, everything under the sun in that 10 to 15 minutes. And then I got to get on to the next patient. So imagine we already have this gap of communication. We already have this gap of a knowledge of even recognizing I need to be a good salesman. And now I'm put in a system that does not benefit it. It's one of the reasons why those who go into concierge medicine, direct primary care, tend to fare a little bit better in getting to encourage their patients to do what they need to do, because they typically have no time restraints in doing so. So you have the general physician who is restraint in time, who is focused on, hey, I just gotta, let me give you this quick medication. Let's see it in a month. Let's see it in 2 weeks. I need things to happen quicker. And guess what? Because it does not happen quicker, guess what? Everyone starts kind of having this divide. Like, hey, this doctor said they were going to take care of my blood pressure. Honestly, I don't even know how this blood pressure thing works, but they don't even have time to talk to me about my blood pressure. All they do is keep throwing me a pill and say, hey, take this medication. And I don't feel nothing when I take this pill. So you have all of these different aspects of a patient wanting a quick fix. You have the doctor needing a quick fix because they don't have a time for a slow fix. And then when it comes to our health, a lot of times it is the long run. It's that marathon approach. It's that, all right, I'm going to see you in 6 months, 1 year, 2 years, 5 years, because that's how long it may take for you to get healthy and, more importantly, remain and stay healthy. So you have this system that is butting heads as well. So you got poor training. We already talked about that in the first section. Poor training leading up to doctors who don't really know how to communicate, don't understand the importance of communication, couldn't even tell you the proper tactics to get someone to persuade them to do something because they've never been taught that. And then they run into a system that does not prioritize having good conversation, having good communication, being able to be as detailed as possible, because sometimes it takes being detailed as possible to get the job done, right? They're in a system that does not prioritize that. So they're either forced to break away or forced to deal with this inadequacy of success. And when I tell you one thing physicians hate, they hate when they're not successful, right? And that's that quick fix, right? That's why a lot of my colleagues who go into surgery, they like surgery because, hey, gallbladder needs to be taken out. Hey, I take your gallbladder out, you feel better. You like me. Hey, you broke your hip. I fix your hip. Right? You like me, right? Because there's an immediate, solution to the problem at hand. But when it's, hey, it's your blood pressure. Hey, it's your diabetes. Hey, we got to get your cholesterol under control. These things that are typically slow in developing, right? They don't like the slow and developing play. They like the quick little Hail Mary streak down the sideline. That's just not something that they're accustomed to. And as a patient, right? Every time you're paying your copay, you're paying your insurance, you want quick fixes as well. And that's not happening. So you have this system that, again, is a butting head to our goal of getting healthy. And it's just unfortunate that we keep running into this situation. But what do you have to do, right? Because the system is the system. You just have to be able to work better within the system, right? And we're going to talk towards the end as far as kind of different tips and tricks that I would suggest to kind of get your patients on. But I think it's important to recognize, hey, there is a problem there and it's not necessarily all your fault. All right, this next section here, I think is, I've been kind of alluding to it. Doctors aren't salespeople, right? We did not go to school to be salespeople. We didn't even know that we needed to go into sales. We didn't even know that this was a trait that we should have. And again, I'm biased. I probably do a lot more digital marketing and business related conferences than I do medical conferences. It's because I realized very quickly, I'm like, all right, if I'm going to be a great physician out here, there are other attributes that I need to have picked up that my school didn't tell me. I realized that very early. But doctors aren't natural salespeople. A lot of them don't have the charisma. A lot of them don't have the art of persuasion, don't even know about the art of persuasion. And more importantly, a lot of them are kind of walking around in the dark, not realizing that these are good things they probably should have. So you have a doctor who is over here, says, hey, like I went to school, I got all of these good grades, I did all of these research and presentations and journal articles. But then when I get over here, I'm running into patients who aren't listening to me, who aren't following my directions, and are blaming me for being the reason why they are not healthy. Like, how does that work? Think about that. Like, I did all of the things I was supposed to do to become a quote unquote good doctor. But once I got out to the real world, I realized, all right, there are a lot of things that I am missing. So doctors aren't the best salesmen. They aren't trained to be salesmen. They aren't salesmen by nature. So guess what? Now when it's time to sell you, because that's what we're doing, when it's time to sell you on being healthy, guess what? You're like, all right, I'm not buying what you're selling. Like, I hear you say this medication is great, but the way you said it, I don't know if you think the medication is great. And because if I don't believe that you believe, guess what? I'm not going to do it, which happens all the time, unfortunately, in every level, whether you're doing outpatient medicine, inpatient medicine, rehab medicine, every single level, the doctor has to be able to explain away what's going on, right? They have to be able to explain away that, hey, this is why you need to take the leap of action with me. And it has to be with me. This is why you need to take the leap of action with me. Because if you don't, you're going to have bad blood pressure and bad sugar. You can spell doom and gloom, but they don't believe you. They don't even believe that you can get them to that promised land. So guess what? All of the doom and gloom, they're not really going to believe that as well. So it's extremely important to understand that we're not natural salespeople. But when you run into a physician like myself who is actually good at doing that, you may start thinking like all of the doctors are like this until you realize like, no, this person had to do a little bit extra work to get to the point where they're at this moment here. So extremely important to recognize that your doctors just aren't natural salespeople. All right, and so this is a big one, and I think I'm almost sure I did an episode on this. I'd have to check. I talked about doctors being coaches or something like that, or should your doctor be a coach? And I argued at that time as well too. I think a lot of the reasons why our concierge medicine physicians, our direct primary care physicians, the reason why they tend to do better, right, is because they are better at being coaches than they are better at being doctors. And what does that mean? They understand that patients don't want to be lectured to. You don't want to have to pay a copay to hear a 10-minute lecture, a 15-minute lecture from someone who's speaking in words you don't really understand, talking in tones that aren't as comforting, aren't as nurturing. And then they're just saying, hey, take this medication, this random medication at the end of the day that's going to cost me extra money, right? Patients aren't falling for that. They probably haven't for a while, but they just aren't falling for that, right? So you have to understand that your patients need a coach in their physician. Your patients need a coach in their physician because they need someone who will walk them down the path, explain them what needs to be explained, not necessarily be constrained by any time-related issues of why I can't go into detail the way I need to go into detail. I talked about this when I started doing outpatient medicine. One of the reasons why I did the lunch and learns with Dr. Barry is because I realized very quickly, hey, I don't have time to talk to my patients in the way I want to talk to my patients, but guess what I can do, right? I can't say, hey, guess what? I'm diagnosing you with high blood pressure. I'm diagnosing you with high cholesterol. But guess what? I just did a video about 30 minutes to an hour talking about high blood pressure, talking about cholesterol. Go on my website, check that video out. If you have any questions, guess what? You can ask me questions on that video, right? You can go to that video, ask me some questions there, and guess what? It's not going to be a random stranger replying to you. It's going to be me, right? So now they recognize that, hey, you know what? Doctor talked to me for about, because I was still talking to him about 10, 15 minutes. Now, I will be honest, my appointment times were 20 minutes, which is something that my higher ups had a problem with, right? Because they're like, why are your appointments time 20 minutes when it should be 15? And maybe wondering what's the difference? Because in 20 minutes, if you do 20-minute appointments, how many appointments can you get in an hour, right? 3. But if you do 15-minute appointments, guess how many appointments you can get in an hour? 4. So the higher ups are looking like, hey, you are not getting one extra patient per hour. So if you work a total of 7 hours a day, you are losing 7 patients per day, which is 35 patients per week that you are not seeing, right? Because your appointment time is 20 minutes versus 15. For those who may be wondering why appointment times are 15 minutes, there go your reason why. But I was like, you know what? Nah. That 15 minutes is way too much. I don't want my patients clock watching the second they walk in there. I want them to know that, hey, you got 20 minutes with me. Now, and I've said this before, I'm on record saying the majority of your doctors, especially the good ones, don't really need 15 minutes to diagnose and treat. They don't. What they need is about 15 minutes to diagnose, treat, and then educate. Let me say that again. Majority of your doctors do not need 15 minutes to treat. They don't, right? We're very good. In about 1 minute and a half, I have an idea of what I'm going to do. But guess what I have to do after that 1 minute and a half? I may have to explain and educate what we're going to do next. So when you hear about 15 minutes, it's not like your doctor is, I won't speak for everyone, I'll speak for myself. It's not like we're racking our brains the whole 15 minutes of what we're going to do. No. We got that answer like in the first 2-3 minutes. Let's say 5 to be generous. We're spending the extra 10 trying to educate our patient so our patients can get to that point where they have a little bit of understanding. We're not expecting our patients to understand it in 2 minutes because guess what? That's why we went to school. So we're not expecting that to occur, but we're spending that extra 10 for me, 15 minutes, explaining to our patient, hey, this is what I want to do. This is why I want to do it. This is why you need to follow it, aka I need to sell you. That's when my sales time goes in. I go into sell mode after 15 minutes. After 5 minutes, it's sales time for me because I understand like, all right, I did a job. Boom, I got it. This is how I'm treating it. This is why I think it's happening to you. Now I need to spend the extra 15 minutes selling my patient on the idea that I got that answer at 5. That's really how the game goes. So understand that patients need coaches. They don't need someone who's going to lecture to them. They don't need someone who's going to tell them, hey, you got 5 minutes left because I got 10 other people. Like they don't need that. So I think that is another issue at hand of why doctors tend to have a bad time at trying to get their patients sold on their health because you know what? They're good doctors, just terrible coaches. And when we're trying to sell a person, because that's what we're doing, all my healthcare providers, to get this through their head. You are selling your service. If you are a surgeon, you are selling the idea of getting surgery. If you are an internist, you are selling the idea of taking that medication, decreasing your diet, exercising more. You are selling that idea. Like you're not telling the patient that, you are selling the patient that. And you are in a position where guess what? Patients are coming to you to be sold. So it's not like you shouldn't have to do that much extra work because the patients are coming to you, right? They're coming to you to be sold. I talked about this all the time, especially during the height of COVID and everything. When COVID was happening, especially for a lot of my people who were like anti-vaxxers against medicine and all these things here, and then boom, the unfortunate happened. They ended up getting COVID, they ended up being hospitalized. I didn't have to do much convincing that you needed to take these medications that on the outside you were acting like were government, conspiracies and man-made. Like, no, you took every single medication I gave you because guess what? You were in the environment where you were ready to be sold, right? I say this all the time. In the hospital setting, no better environment to try to get someone like on their path was when they're ready to be sold. And when you're sick as a dog, guess what? Yeah, healthcare provider comes in strolling, right? And you just kind of do what needs to be done because you want to go home because you know that's not guaranteed, at least for the most part. And I say this all the time. It's not guaranteed at all for you to leave a hospital. So understanding that your doctors can be great doctors, but if they're not good coaches, if they are going with this super lecture style and just kind of berating you, like it over your head. You're not paying any mind whatsoever. And that's really kind of how the game goes in that regard, right? So understand that doctors could be great doctors, but if they're not great coaches, guess what? They're going to have a hard time selling you like their service. They're going to have a hard time selling you your health. They're going to have a hard time selling you your health outcomes. It just is what it is from that perspective there. So just to give some tips, because I think that's important, right? I think it's important, especially for my healthcare providers, my doctors here who watch this, or even my patients who are trying to figure out, why am I having trouble with this doctor right here? These are some tips that I like to use, right, when I'm trying to sell my patients on being healthy, right? These are tips that I like to use because I think it's important for us to do so. So some of the things I do, right, again, my training did not prepare me for this, right? I had to do a lot of extra training just to, get a handle on, okay, all right, these are some of the things that I think is successful. First and foremost, right, you have to be able to slow down. And even though you have a clock running in your mind that says, I only got 15 minutes, or if you talk to these hospitalist doctors, I only got like 5 minutes, because in the hospital, they're in and out of the room quick as fast. It's almost hilarious how quickly they can get in and out of the room. But you have to be able to slow down and talk to your patients, and then you got to listen. One thing that I read, I'm not sure if it was a study, I forget what I read, is that doctors will spend like 10 seconds. It's like, it was either 10 to 30 seconds before your doctor will interrupt you, right? The patient. And one thing I know, when you are trying to sell someone something, right? Whatever that something is, you have to let the person who needs to be sold get their words out, get their questions out. You have to be able to ask, all right, do you have any more questions? Okay. Do you have any more questions? Okay, because when you are getting them to ask their questions, and more importantly, when you are answering the questions that they're asking, that's a big one, right? Because there's no point to have your patients asking you questions that you can't actually answer. That's a good way not to be sold, right? But once your patient recognizes, all right, I asked about this, and I asked about that, and I asked about this, and my doctor knew all of these answers, guess what? You're essentially knocking down any objection that they may have when they leave your office, right? If there's a question, if there's a lingering question that they have in the back of their mind, if you don't give that patient an opportunity to say that question, which is why when you spend this time trying to, get through your little 15 minutes and don't give the patient no time to have any type of feedback, and they leave with questions, right? Those questions become big objections that stop them from doing what they need to do. So you have to be able to talk, but more importantly, you have to be able to listen. You have to be able to listen and then elicit questions out of your patients to say, all right, do you have a question about this? Answer that question. Do you have another question? And a lot of times, right, this is a little caveat. Let's say, hey, doc, I'm having a question about this blood pressure medication. I heard it causes, my skin to turn blue, right? You answer that question, say, nope, that medication here, I understand your concerns. That medication does not cause people to turn blue. What it causes is this. And that's an actual normal reaction for that medication. Do you have any more questions? This is the doctor, right? Asking, do you have any more questions? Because a lot of times we will hear the question of our patient, answer the question, and then we just start adding a whole bunch of other BS story and everything else to try to pile on and confuse the patient. No. Because again, remember what you're doing. When you're talking over the patient or talking through the patient, guess what? Those lingering questions that the patient has in the back of their mind, they can't get out. So you want to get to the point where you probably say, hey, do you have any more questions? Do you have any questions? Do you have any more? You want to get to the point where your patients are like, doc, you answered them all. Thank you, right? You want your patients to have zero questions sitting in the back of their mind before they leave your exam room. Because you know that once they have zero questions, especially if you did a good enough job explaining to what's happening, what they need to be doing, if they have zero questions and there's zero objections, then they're going to follow what they need to follow, right? If they have a question and you allow them to leave that exam room without answering that one question, and sometimes you have to drag it out. Sometimes you have to say, all right, are you sure you don't have any questions? And then you just pause. And then you just wait. And then you lean over. And then you understand, you can even hear in my tone of voice, you have to talk in this kind of nurturing tone. You have to let your patients know that, hey, I am here for you. Do you have any questions? Right? And once you get to that point there, once you get to the point where your patients recognize that, hey, you know what? My doc said all the things they needed to say. They gave me so much time to get all of my questions out there. There's no reason why I should not be following the direction of my doctor. There's just none, right? Because they answered them all. Oh, maybe I could use this excuse. Nope. The doctor said I had a question and I did ask it and he did answer it and I feel comfortable with his answer. So I think that's probably one big thing, right? Like I said, we don't need to go through, we probably could go through a whole episode of just kind of, give or take scenarios on how to get good responses out of your doctor-patient relationship conversation, especially my YouTubers. Drop it in the comments. If that's an episode you want to hear, I'll do it. But like I said, I don't like to geek out on that type of stuff here. But if you want to hear it, drop it in the comments. comments, I would definitely do that, right? So again, I'm excited, right? Fourth quarter is about to come up. End of the year is almost here again. Like the time just moves, right? Like it just moves and moves so fast. So hopefully we're keeping up with our New Year's resolutions, our mid-year's resolutions in regards to our healthcare, because that's always going to be extremely important. And, like I said, I am your accountability partner if you do not have one, right? But again, I just wanted to make sure I wanted to focus today's episode on why your doctor is having a hard time selling you on being healthy. And hopefully you got the answers today. Yours truly, Dr. Pierre. I'm going to see you guys next week.